Great. Thanks so much, Sandy, for hosting this webinar. And thank you all for attending. Normally, we do an annual seminar where we discuss pre-retiree coverage, marketplace coverage, and Medicare all in the same setting. But there have been some significant changes this year to marketplace coverage as part of the American Rescue Plan Act. So we talked about it. We thought it would be a good idea to break this down into two different seminars this year. So we could specifically just tonight look at marketplace coverage and especially the changes that have taken place under the American Rescue Plan Act, which was passed earlier this year. So what those changes did was they made premium tax credits, also known as subsidies, greater for 2021 and 2022. So the amount of the subsidies more, as well as it expanded eligibility for subsidies, making more people actually now eligible for those premium tax credits. So that's what we're going to dive into tonight. I'm going to start out with some basic information about the marketplace because maybe you're not at all familiar with it. Maybe you have been on the marketplace for years. So we're just going to start with some basics. So I'll flip into this screen. So what is the marketplace? Because you'll hear the terms on marketplace, off marketplace for individual health insurance plans. So on marketplace is also sometimes called Obamacare or Healthcaregov. But what it is it was created by the Affordable Care Act back in 2010. It opened up for business in 2014, and it's a shopping and enrollment service for medical insurance. And most people use Healthcare.gov and they do that shopping experience online. But it's a way that consumers can use the marketplace to find health, and sometimes if they want dental insurance coverage, by looking at plans and comparing them online. They can also talk to a healthcare.gov rep on the phone. I've heard you can use the mail to send in an application, although I don't know anybody who's done that. Most of us are doing things online these days. And all this can be done within the assistance of an agent or broker. There's value there in using an agent broker. Sometimes there's things that they know about the plans that may not meet the eye. Also, if you ever run into hiccups with your coverage, perhaps a problem claim or a billing and enrollment issues, an agent usually has a higher level of contacts with the carriers that they can get questions answered usually a little faster and potentially more accurately. So there's value in using an agent. Michigan uses the federally facilitated marketplace, which is your healthcare.gov. There are some states that have their own exchange. So in Michigan here, we do use the federally facilitated marketplace. So I should talk about off marketplace a little bit. So you'll hear the term on market, off market. Off market plans are just insurance plans that are obtained directly through the carrier. So not using healthcare.gov. And a lot of times the plans that are off marketplace and on marketplace are exactly the same plans. But the reason to use the marketplace would be so that if you are eligible for premium tax credits, which reduce the amount you pay for your coverage, the only way to get that is to go onto the marketplace. So to be eligible for marketplace coverage, just a few things. You have to live in the United States, be a US citizen, a US national, or lawfully present immigrant, and be in the country for the entire time you plan to have the coverage. Also, one other little thing, you can't be incarcerated. And then as far as coverage, since the Affordable Care Act was passed, plans are broken down into categories, and they're metallic level categories. So we have bronze plans, silver plans, gold plans, platinum plans, although there are not many platinum plans around anymore. They were just too cost prohibitive. But the bronze plans are going to be your lowest premium plans and also have your highest deductibles, highest out of pockets. But actuarially, it's supposed to, on average, cover about 60% of your healthcare costs with you paying 40%. A silver level plan, it's going to cover about 70% with you paying 30%. A gold is an 80-20 and the platinum's 90-10. Now, when we're talking about actuarial value of a plan, this is not the exact amount of what a plan will pay. So on a bronze plan, it's not going to be exactly 60%. It's just a theoretical projected range of an average amount a plan will pay for covered essential health benefits for a standard population. So just want to clarify that it's not going to work out exactly to 60% on a bronze plans, et cetera. So that's how plans are categorized. There's also one other type of plan, and it's catastrophic health plans. And I will get the question a lot, is there just a catastrophic health plan out there? Well, there is, but it's not in the sense that we usually use for that term. There are catastrophic health plans for those that are under 30 at the time that they enroll in coverage. So they're a high deductible plan, usually around $8,500, and that tends to go up each year, but ballpark $8,000. So higher deductible, lower premiums, but they have to cover at least three primary care office visits during the year before deductible, as well as some preventive services. So those are available to, like I said, those that are under 30 at the time they're enrolling, or sometimes for folks that are over 30 that qualify for a hardship exemption or affordability exemption. And there is a list, if you go on healthcare.gov, that you can look at and see what some of those hardship or affordability exemptions are. I mean, one would be someone that's filed for bankruptcy, or perhaps you've had a natural disaster where you've had substantial damage, to your property. So there's some very limited situations where that might apply. But typically when someone's asking me if there's just a catastrophic plan out there, they're wondering if they can buy just like a plan that would cover hospital only. I had someone ask me last week, I'm willing to pay for the office visits and the labs, things like that out of pocket. Can I just buy a cheaper policy that's hospital coverage only? And the answer is no, not since the Affordable Care Act was passed, because plans, and this is going to lead into this next slide, have to now cover 10 essential health benefits. And those benefits, I'll read them off real quickly, but you can see them on the screen, would be ambulatory patient services like your doctors, your clinic visits, emergency services, so ER, urgent care, hospitalization, maternity and newborn care, mental health and substance abuse, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness, as well as chronic disease management, and then pediatric services. So all plans now have to cover these categories. It used to be, for instance, before the Affordable Care Act was passed, people could carve out maternity, they could carve out mental health, they could even carve out prescription drugs. There were plans that allowed them to do that. And, therefore they could reduce premiums that way, but that is not an option anymore. So let's just move on to, you'll hear the word subsidy as it relates to marketplace coverage, which is the same thing as a premium tax credit. So what that is, it's simply an amount that if you qualify for that premium tax credit, it's just an amount that your premium is going to be reduced by. So subsidies may be available to lower the cost of coverage for consumers in certain households who aren't eligible for Medicare or Medicaid. And it's going to be based on income, also the ages, of the folks in the household, that comes into play. So we'll break that down more in a minute. But the only way, if you are eligible for a premium tax credit, to take advantage of that, and I mentioned this earlier, but just to repeat it, is if you enroll through the marketplace. But prior to the American Rescue Plan, subsidies were available for certain consumers with projected household incomes between 100 and 400% of the federal poverty level. Now, with the passage of the Affordable Care Act, it works a little differently. So it used to be if you were over 400% of the federal poverty level, there was no subsidy. So they called it the subsidy cliff. Now the American Rescue Plan temporarily eliminates that subsidy cliff, making subsidies available to certain people with households above 400% of the federal poverty level. So we're going to look at some examples of that in a minute. But now what the qualifier is, instead of it being a percentage of poverty level, the qualifier is that the benchmark plan, and let's talk about what a benchmark plan is, and this is where it gets a little complicated, but the benchmark plan cannot exceed 8.5% of your income. So if it does, that throws you into a category where you're eligible for subsidies. So a benchmark plan is simply the second lowest cost silver plan available in your area. And the price of this plan is used to calculate the subsidies. So if you look at this chart, what it's showing is the percentage of income that the benchmark plan could not exceed prior to the American Rescue Act, that's the middle column, and now since the passage of the American Rescue Plan Act. So you'll see how those percentages have dropped. And notably, where you see that at 400% of poverty level, previously there was no longer a subsidy. Now there is for some people still a subsidy as long as that benchmark premium is not exceeding 8.5% of their income. So kind of a complicated slide, but I think what's going to help in a few minutes is we're actually going to look at some real life examples in just a minute. But first I want to talk about, people ask, well, what is my income for purposes of a subsidy? Is it, my gross income, my net income? Well, what the marketplace uses is modified adjusted gross income. So what that is that's your adjusted gross income, which is a line item on your tax return, but you have to add back in any untaxed foreign income, any non-taxable Social Security benefits, as well as any tax exempt interest. So those items on top of the adjusted gross income get you to your modified adjusted gross income. For a lot of people, it is simply their adjusted gross income, but not everybody. So when you are applying for a marketplace plan, the question often gets asked, well, do I use last year's income or this year's income? So what you have to use is the income for the year of the coverage that you're applying for. So we're coming up to open enrollment here pretty soon. It'll start November 1st. And this is when people can enroll in plans for a January 1st, 2022 effective date. So you have to project your income for 2022. So it's not an exact science because we don't always know exactly what that's going to be, but you want to guesstimate it as close as possible because there is a reconciliation that does take place. So you guesstimate it for 2022, but then when you file your 2022 tax return, there is a form that needs to be filed along with that tax return. And if the income is more than the income that you claim on your tax return is more than the income that you gave on your marketplace application, you will owe money back to the IRS when you file your taxes for that. However, if the income that you put on your marketplace application was understated, then you will receive a credit or a refund when you file your tax return. So, and sometimes I also want to mention the marketplace will ask for proof of your income. So if it's maybe it's Social Security income, they may want to see a benefit statement from Social Security, or if you're self-employed, they may want to see a current profit and loss statement. So there are times when they do ask you to verify that income, and they usually give you about 3 months to do it from the time you apply. So I want to look at a slide that I actually took the data from a presentation I did a couple years ago, because this will kind of give you an idea how subsidies have changed based on the American Rescue Plan. And if I didn't make it clear in my introduction, I want to reemphasize that this is temporary, that it's in place for this year and next year, 2022. Whether it could get extended beyond that, I don't know. I mean, anything's possible, but for now, what we know is it's available for this year and next. So if you look at this slide, I am showing, it says 2019 monthly premium tax credit. Now this was based on 2019 plans. And in my example, I had used a 62-year-old male who lived in Oakland County, because the amount of subsidies also have to do with the geographic area you live in, which will become more clear in a minute. But basically back in 2019, if John was at 20,000 of income, that would result in a $650, oops, let me turn that down. Apologize for that. That would result in a $650 per month premium tax credit. So whatever plan he picked, he would be able to take $650 off that each month. And you can see as his income is higher, that premium tax credit is reduced. And at about 49,000 was where there was no longer any premium tax available to him. So you can see that subsidy cliff where it went from $337 a month at 48,000 of income to nothing at 49,000. So let's say in 2019, John had applied for coverage and he said he was making 48,000 and he took that $337 a month premium tax credit. If when he filed his taxes, if he actually made over 48,000, let's say he made 49,000, he would owe back that $337 a month. So $337 times 12 when he filed his taxes. So there's not like a gradual phase out of that subsidy with income. Rather, there's just a place where it just stops. So now with the way that they have the changes that they made under the American Rescue Plan, you can see on the right side of this little chart, how all the way up to 96,000, John is, well, I'm calling him John, but my 62-year-old male is still eligible for a premium tax credit, albeit it's not much, it's $5 a month, but you can see that it phased out instead of just dropping off. So that gives you a little visual of how that has changed under the American Rescue Plan and how more people would be eligible for subsidies because it's allowing people with higher incomes in certain cases to still qualify. And part of this depends on your age too. So the younger you are, like a younger person making these incomes would not be eligible for this much of a subsidy. So age factors into it because it's based on the benchmark plan premium, and that premium is going to be less for someone who's younger. So sometimes this might be a little too detailed. And that's why shortly here, I'm going to take you to healthcare.gov in one more slide and show you some examples and show you how you can use healthcare.gov to see what you might be eligible for. So there are some people, I want to talk about cost sharing reductions, who not only get premium reductions based on certain incomes and household size and the age in the household, but they also get cost sharing reductions, which means and the consumers that would get that are people that fall between the 100 and 250% of federal poverty level. They're the ones that would qualify for these cost sharing reductions, and nothing has changed with that under the American Rescue Plan. But if you fit into that category, you would also be eligible to have your deductibles and your copays and your coinsurance reduced. And there can be significant reductions on those, again, depending on where your income is at. In order to get the cost sharing reductions, though, you have to enroll in a silver medal plan. So we are now going to pop into healthcare.gov, and this is where you're going to see how this all works. So I'm going to try to get my browser up here. And so again, this is, and you guys may have already been on this site, but if you haven't, you just go to healthcare.gov. And all right, I recommend just click on get coverage. We're not actually going to get coverage, but if you click there, you can then go down to where it says see plans and prices. So don't put your state in here because then it'll immediately take you to an application. So just window shop, see plans and prices, and you click there. And I want to show you a couple different examples. So I already showed you like the 62-year-old male that lived in Oakland County on that, chart, what he would be eligible for. So let's look at a different county and you'll see how it's different based on geography. So I had a client that I was working with last week, and she's in the 49286 zip code, which is Lenawee County. And so rates are not gender based, so it doesn't matter male or female. but she was 62 years old, female. She was not eligible for Medicaid, Medicare, or CHIP, or any of these things. She wasn't a legal parent or guardian of a child under 19, wasn't pregnant, not a tobacco user, so we just check none of these. And then confirm. And then let's put in an income. So if I'm just going to tell you that on that slide a few pages ago, where I used the Oakland County example, at 60,000 of income, he was eligible for a $260 subsidy under the American Rescue Plan changes. So let's do her at 60,000. Look at the difference from Oakland to Lenawee County and the amount of the subsidy. And the reason for that is, if you'll recall, I said that subsidies are based on the second lowest cost silver plan in your area. So there are many more plan options in Oakland County. There are narrow network HMO plan options that, bring that second lowest silver premium down. Whereas in Lenawee County, there's not as many plan options. So the second lowest cost silver plan in Lenawee County is much more expensive. So that's why the premium tax credit is greater there. And in fact, where my example in my chart where he really phased out at 96,000, with this particular client, she was still eligible up into the, even 100,000 of income. Yeah, at 100,000, she was still eligible for $246 a month. So in years past, where, at 49,000 of an income, she would have been eligible for nothing. Now here, I just put in $100,000 and she's getting $246 a month off her premium. So big changes because of the American Rescue Plan. So if you have not been using the marketplace and you are in that, don't have employer sponsored coverage, and you are in that individual market where you're not yet to 65, where you may not have been eligible in the past, you may now be eligible, at least for 2022. So it's worthwhile, to check this out. And then it's worthwhile to mention as well that some people are able to structure their income in a way that they can keep their taxable income within a range where they do qualify for subsidies. So maybe they're pulling some out of taxable qualified accounts and some out of non-qualified accounts. So that's something that you work with your financial planner with to, get you into the most optimal range. And they have to look at, of course, a number of different things in that picture. But I also want to show you that at certain income levels, let's just go back here. Oops, I went too far. I really went too far. We're going to edit that and now go back. Let's see. All right, I'm just going to have to start from scratch here. But I want to show you that there is also a point where you're not eligible for a subsidy, and it says at this income you're eligible for Medicaid. So you have to make a certain amount, to qualify for the subsidy. I'm just going to put for this one on Oakland County, zip code in. And we will still work with a 62-year-old male. So let's say his taxable income was, maybe he's just getting a small Social Security check. It would only be bringing in 16,000. It's going to show, okay, may be eligible for coverage through Medicaid. So, with that income, his option would be Medicaid or to pay full price for a plan. So I'd also like to show you cost sharing reductions. We talked about those. So at certain incomes, let's just try, I think at 40,000 might still not be eligible for cost sharing reduction. At 40,000, there's a $474 premium tax credit. But the way to see if there's any cost sharing reductions is you go into the plans and add filters. And if there was cost sharing reduction available, it would pop up a note here by Silver Plans. So 40,000 didn't get him the cost sharing reductions, but I think 30,000 will. So 600 a month premium tax credit. So now when we look at add filters, he is getting extra savings on the Silver Plans. So if we look at the silver plans, it's showing, I'm going to pick a plan that, okay, for instance, this My Priority Health HMO Silver 5500 plan. This plan would normally have a $5,500 deductible, but because of the cost sharing reduction eligibility, it's being reduced to a $3,650 deductible. And where it really gets interesting is, and I do have some clients that are able to keep their taxable income in this range, but at $25,000 of income, you'll see that the deductible is greatly reduced. So now that same plan we looked at a minute ago, this $5,500, that deductible is reduced down to $650. So it's quite a savings on your out-of-pocket costs. You know, as I've been going through these slides, and thinking about things as I'm talking, I did want to mention one other thing. If you are eligible for an employer-sponsored plan, either through your own employment or through a spouse's or a parent's, you're not eligible for subsidies on the marketplace. The only exception to that is if your employer coverage does not meet the affordability definition under the Affordable Care Act. And that definition, I have to look at my cheat sheet, is what you pay for your employer sponsor plan for self-only coverage would have to exceed 9.83% of your household income for you to be able to go on the marketplace and get a subsidy. So that's not typically the situation for most people that are offered employer coverage, but it is the exception. And then just as far as, let's say there's more, I want to show you a couple more examples. We're moving along pretty quick here. It's only 6:25, but let's add a spouse. And let's make that spouse Medicare age. So 66-year-old, I don't remember if I did female or male, but I think I did female. I'm going male here. It really doesn't matter. But now we have to check the box that they're eligible for health coverage through a job, Medicare or Medicaid, because that person is. So continue. So we now have, okay, I have two males, but we have a 62-year-old party and we have the 66-year-old spouse. And let's still use 25,000 of income for now. So that person is still getting that $685 a month premium tax credit at 50,000 of income. Still $452. So it's still, even though, so you have to count the income from the whole household. So I get that question a lot. Is it just my income or is it the spouse? So even if the spouse is not going on the coverage because they're eligible for Medicare or Medicaid or a job plan, you have to include the total household income in this. Now, another interesting thing that happened this year under the American Rescue Plan Act, this really surprised me, but I'm going to throw in an income now of $300,000. Okay, so we know we're outside a subsidy range here, but it asks the question, will any of these people get unemployment compensation for 2021? So let's just check you. Because you were eligible for unemployment, even if you then got another job, they're still giving you that premium tax credit. So it's pretty interesting how that works. So I did have a few clients that fell into that because they did collect unemployment this year. Now, if that's your case and you're not on the marketplace, you still can enroll for coverage for 2021. It's a special process you have to go through. But I also want to mention that this part of the American Rescue Plan change, where somebody collecting unemployment was eligible for these large subsidies, is not in place for 2022. So that part is gone for next year. So I would advise, if you think you might be eligible, for a subsidy, go on healthcare.gov and play with the numbers, put in your household ages. You can add dependents, if you have children that you're covering. So the people you want to include when you're putting in your household information is anybody that you would be including on your plan. You want to include those members, and you have to include, for income, you have to include everybody in the household's income. So, and as you fill out an application, it does walk you through that. You can also, use the assistance of an agent to help you with that. But I think that's probably some pretty good examples there using healthcare.gov. So familiarize yourself with that and see if it's something you might qualify for. And now going back to the PowerPoint, I get the question sometimes, well, how do people use premium tax credits? Where do I get this money? Are they going to send me a check? Well, you actually have a few options. So what most people do is they give you 3 options. When you apply for the subsidy, they tell you what you're qualified for. You then pick your plan, you do your shopping. And once you pick your plan, it gives you 3 options for how to use that subsidy. So the most common one is the first one listed here, and is to take that full amount every month off your premium. So when you get your bill from the insurance carrier, it will have that subsidy reduction included. Another option is to take a partial amount monthly. So you could elect how much of that subsidy you want to use each month to reduce your premium. And sometimes people will do that if they're not confident they're accurately estimating their income. And so for the next year, so they don't want to take too much and then owe it back. So they take a partial amount. And then if they end up being eligible for the total subsidy, they will get that back when they file their tax return. Also, there are some people, not many, but there are some people that don't take anything up front and they just wait till they file their taxes. And that can be a good strategy for someone who's borderline subsidy eligible. Now, there was a couple of other things I wanted to mention, and they went in and out of my mind. Oh, what first happened when the American Rescue Plan Act was passed is they did reach out to their marketplace consumers. If that's you probably got an email, and it advised you to update your application. And that way you could take advantage of the increased subsidies, right away. So there was a lot of people who did that. I work with clients, we updated their application, and we really didn't have to change anything. We just had to go through all the screens again. And then at the end, it showed them their new subsidy amount. So that's how it started out. If you don't recall, this act was passed, I believe, like late in March. So while the increased subsidies will go back to January and people will be able to get that when they file their taxes, it did start mid-year. So that was what they were advising initially. But they also did say, if you don't do this, if you don't update your application, you'll still get this additional subsidy you would be eligible for back when you file your taxes. So you weren't going to lose out on it. But then what happened later in the summer is they automatically started sending out notices to people who didn't update their application, basically saying, oh, we've gone in and done this for you, and your premium starting in September is going to be reduced. So it kind of evolved as the year progressed. So I wanted to mention that. And open enrollment starts every year, November 1st. It goes till December 15th. And that is the time when you can apply for a marketplace plan. There's no pre-existing conditions. There's no medical underwriting. So you can always apply for a plan that time. You can't be denied or rated higher. The effective date of the coverage will be January 1st. If you're already on the marketplace, that's the time when you can change your plan. It's also a good time if you've had changes in your income to go in and update that application. Outside of this open enrollment period, the only time that you can enroll is if you have a qualifying life event. So maybe you've been on an employer plan and you're retiring. That opens up a qualifying event to be able to enroll due to the loss of the employer coverage outside of the open enrollment period. There's other events too that would trigger that. That's the main one though. And I think that is the end of my presentation. So it's, I'm just trying to give you what's most pertinent, relative to the changes that have taken place with the American Rescue Plan Act, so that you can consider it for next year. And let's see, it looks like there are a few questions, and I will just say, oh, Sandy, go ahead.
I was just going to say, let me, I'll let you say what you're going to say, but before we tie up and start answering questions, I want to kind of end this part of the presentation, but I did want to, before people sign off that don't want to listen to the question and answer session.
Okay.
I just did want to say thank you to Cindy for this. It was a lot of great information, and encourage people to contact Cindy if you have any individual questions that pertain just to your situation that you think you don't want to answer or ask and have answered in front of other people, and or if you think that you would like help going through the process of analyzing your own situation, because she's wonderful to work with. We've had lots of great feedback, and that is what she does. So if that is something that's of interest to you, go ahead and reach out to her, and she'd be happy. I'm sure she'd be happy to work with you. So I just thought I'd throw that out there, because I know she wouldn't be pushy enough to say that on her own, because she likes to come and just give information, but that is what she does for a living, and she's great at it.
Thanks, Sandy.
So feel free to reach out to her if you'd like some help with this process, because it can get overwhelming, and she's wonderful.